it's about how to trick the mind for the better, and for people to feel comfortable with that, because it's not easy to move away from traditional ways of teaching and learning medicine.
Marlies, welcome very much to the EFA 2023 podcast. It's wonderful to have you here. How's your Berlin experience been so far?
Well, thank you for having me. It's a delight being here, and Berlin is great. And my experience here has been a bit overwhelming due to size.
Yeah, it's huge.
It's huge. But I like to be here, and I like to represent the importance of crossing the boundaries between creative industry and healthcare.
So for the people at home who might not know you or be aware of your work, can you give us a little bit of background on, your history and kind of what you're focusing on at the minute?
Sure. I started out on Design Academy, and I crossed over to medicine.
A story as old as time, from design
story as
to
old
medicine.
as time. But it is because I like to explore, I like to be hands-on, I like to use a creative spirit. That's probably also why I became a surgeon, because then you have to solve problems creatively and with your hands as well.
I've never really thought about it like that, because it is a very, culpable thing. It's tactile.
It's a tactile profession, but it also is about dealing with limited resources, with sensitive areas, with people, with technology. It's for me, it's a perfect match.
Yeah, a real amalgamation of all different skills and things kind of pushed together into this one high-pressure environment.
That's it. And, my research is about how to deal with such a high-pressure environment best.
And one of those things that from your research and talks I've seen is this link between gaming and play and surgery. And, when I first heard that, I was a little bit, befuddled. Like, it doesn't always seem the most natural connection when you think of the pure seriousness of life or death matters on an operating table and a game. Like, how do those things interact?
Yeah. Well, we lost the perfection of there is a natural connection, because we interact with each other, with our materials, with the patient on the table, with our colleagues, and capitalizing upon the fun theory, the theory about how to play well, the homo ludens they call it. If you're aware of what you can use from that to perform at your best, I think, that's what that's my area of research, to try to help people better understand that play is not a word that should have a negative connotation in healthcare, but it's about how to play well and how to know the boundaries, how to push the limits, how to get into the flow zone, how to be super focused, how to deal with all the uncertainties around you, and maybe play in a playful fashion before you really engage into the serious business.
And how does that work in an actual sense? So do you start with surgeons when they're training to input playfulness? So then how does that work in actuality?
Yeah.
I mean, maybe it's worth explaining kind of how traditional surgeon training goes and then how it's altered.
Yeah. Well, traditionally it's master apprenticeship, and you get a seasoned surgeon who has an apprentice and who learns. It's the Helstedian approach, we call it. It's no longer possible because we have a large group of residents. You don't have a one-on-one connection, so we have a group of surgeons who train a group of residents, and there's also a lost in translation risk there. Because I don't know all the residents well. One day I work with this person, next day I work with the next. So it's hard to keep track of the portfolio of such a person who can have a good day or a bad day as well. Yeah. And I think we need to make sure that we give them room to engage with their their future profession well, which also means they need to be able to explore that safely, and that you can do well using games or gamification methods. For instance, they have to learn to engage with some types of technology, and you can give them an e-learning or a book, and you can give them a test, and they will usually pause and then forget all about it.
Yeah, just kind of the by rote learning that we've grown up with, right? Like,
that's it.
You learn to pass an exam, not necessarily to learn for the sake of learning.
Right. And Well, Einstein already said it. Fun is the most important thing to remember or evoke emotions. It can be negative, can be positive, but if you have emotions with something, you tend to remember that event or that action moment. And so if you can have residents play and have fun, or be challenged, they're much more likely to remember what they have learned. And to give you an example, they need to deal with, very, how do I say it, very complex kind of technology in the operating room. It's like a cockpit. So what I did is I excuse my language, I fucked up the cockpit.
No, it's fine. We're an adult podcast here.
That's it.
We can use whatever.
Whatever word.
Yeah.
Yeah.
Well,
And they-
within reason.
yeah, of course. And they had to find the fuck ups I made, and they had so much fun trying to find what was hidden in. I said to them, I have 4 fuck ups in this system. Find them, and they explored to the max, and there were groups of residents and. When they completed it, I said, "Now you make the fuck ups for the next group," and they had so much fun doing that.
Of course, because you're trying to hide it and
it's like
create
Easter
tricks.
eggs.
Yeah,
it's
exactly.
like Easter eggs
or
hiding.
like a Where's Wally book.
That's it. And they still, to date, even residents I trained 6 years ago, they still remember those fuck ups, and they are able to deal with. If all works fine, you don't need that kind of knowledge. But if something doesn't work fine, you cannot relate or rely on the nurse to solve it. You have to master it yourself, because in the end, you're the one who's responsible to deal with your equipment. And so that's an example, not so much about games, but about gamification of the context you work in. And well, in my research, there are a lot of lines. There's gaming. Actually building games on HTML platforms for iPhones to train them, snapshot learnings. There's gamification, there's nudging, how to tempt people into behavior for them to make a constant decision. Will I move left or right? And to nudge them in the right direction is something wonderful to do.
And has there been any pushback? I imagine lots of people would be quite on board with it, but is there a traditionalist set that really thinks, no, book learning, this is the way we've done it, this is the way we should continue to? And I guess, how do you combat that as well?
Yeah, I think if people ask me what are you most fond of remembering, is when they made fun of me. And that was because I put a sticker on my forehead with my name in the operating room. And this was people were looking at me strangely, like, "Is it kindergarten? What are you doing?" I said, I cannot remember the names of the ones around me, because I'm so focused, and people move in and out. They wear caps, they wear masks. I cannot identify persons by eyes only. It's not in my capacity to do that well. So I put my name on my forehead. A bit leading by example. And especially my colleagues, and well, most of my colleagues are a little bit male, older colleagues still. They were thinking of me. I like, are you crazy? Do you expect me to put my name on my forehead? Everyone knows who I am. I said, yes, but do you know everyone around you? And now, well, we're 3 or 4 years later. Everyone has the name sticker on their cap because it simply works.
Yeah, of course it does, because there's so much mental load, especially in what you're doing, to remember everything, and sort of residents coming in and out.
Yeah, and it's not about the first person doing it, me. It's about the first follower. That's the person who's most important, because then it becomes how do you create an initiative towards a movement, and those types of thinking. I'd like to explore, to make healthcare better.
And you found that's been the general trend, that it's been you need to get that first person, that early adopter on board, and then there's kind of a cascading effect afterwards.
Yeah, people are usually afraid to leave whatever is known to them or what they're comfortable with. And sometimes they don't really understand why fun is important or why insights from gaming are important. But if you tell them that, in the United States, children spend more hours gaming than they are in their school. It's like if we don't, and you don't have to tell them to game. So to delve into that kind of psychology, really, how to be able to use parts of that way of thinking into serious business without compromising the outcome, that's a challenge, and that's a challenge I'm fond of exploring.
Yeah, effectively to work with human behavior and things that work and make them function for you, rather than trying to do something that's maybe antithetical to how people work, but is a historic way of doing things.
That's exactly it. It's about human resource management, much more than about building a game. Or it's about how to trick the mind for the better, and for people to feel comfortable with that, because it's not easy to move away from traditional ways of teaching and learning medicine for people, because people don't want to be ridiculized, or you have to have a strong backbone to endure criticism or skepticism until people see that it works.
And then you get the Russian joy of
And
being
then you
right
get the
all
Russian,
along.
but it's evolving. It's about connecting and evolving, and I think many people forgot really, and I think when I was 18, 19 years old, that I did a year of design academy. That year helped shape my juvenile brain into understanding why some types of design work or not, and how why people lineate towards one proposition instead of the other one.
And how would you like to see your kind of thoughts, your learnings, this idea of implementing fun and playfulness back into medicine? How would you like to see that pan out on a local level in Amsterdam and the Netherlands, and in a global context? How would you like to see the entire worldwide society of medicine and surgeons change?
I think in Amsterdam we have the big gaming industry. We have guerrilla games. We have where Killzone was built, and there's a lot of creative technology there. And I think we as physicians or healthcare workers can also use the gaming community to help solve us with questions. And I say that because there was in the Netherlands we had a lot of research going on HIV, but we couldn't find a specific piece of the puzzle. Then we gave that question back to the gaming community, and what researchers were not able to solve in 10 years, the gaming community solved in 10 days. Of course, they didn't know what they were dealing with.
They were just dealing with a puzzle, like a
game.
They
were just dealing with a game. And you see it now also that, we ask, or not we, on the internet, there's a website made by the medical community asking people to donate their health data in gaming, towards a gaming proposition. So the public can also help play for the microbiome puzzling. And so there are many crossovers. And that's what I also like so much about IFA Berlin, is that you see industry crossover. You see people thinking about using wearables and using patients driving their own health and force, but they don't understand the rules well yet of the medical community. You cannot have patients collect all and then put it on the table, virtually or not, of a doctor for him or her to make sense of it. It's like keeping such lists and what to do with it. So the translation there needs to happen. And you see it coming now here at IFA Berlin. If I go to medical conferences, I see the other side. There are big industry moving towards, weight scales, wearables, self-monitoring, even on bodily specimens, but not knowing how to reach the patient community well.
Mm-hmm. And so it's really, as a sense, the future is cross-pollination.
That's it.
It's understanding, being respectful of both sides, but then understanding there's still a huge amount you can learn. You just need to put it through effectively a translation mesh so it gets to the other side and is taken on board.
And you have to decide on the rules.
Yeah.
Yeah.
Oh, Marlies, thank you so much. That was utterly engaging talk. And yeah, I wish you the best of luck in making surgeons' lives less boring.
Yeah, and see you back in Amsterdam.
Yeah, see you there.